Okay, Jenny, I think you can go ahead and take it away.
Thanks, Katie. Good Monday morning, everyone. Thank you all for joining us at 8 a.m. on a Monday morning for what I believe is the 5th meeting of the Values and Principles Work Group for the Universal Health Plan Governance Board. So just a reminder to everyone, in these meetings, we do not take public comment, but the public is welcome to come to the meetings and to observe. And if there is something that you would like to comment about these meetings, please feel free to submit written comment or to come to our board meetings the third Thursday of the month. I believe this month it's August 15th, and provide testimony either virtually or in person at the board meeting. Katie, you can go ahead and go to the first slide. So a little bit of the agenda review, and then Katie will do the roll call. So just a little bit of a review. Like I said, this is the 5th time this work group is going to be meeting. We got some public comment after the last work group meeting, and that public comment was discussed during the last board meeting for only a few minutes. But Michelle did ask that the group take a look at the public comment we received from Tom Sensick. He had taken some of the work that the group had done and reorganized it and added the values and principles that are in Senate Bill 1089 that the board is required, the values and principles the board are required to uphold. And so the work group took a look at Tom's work and made some comments on that. And I will go over the comments that we got once we get into the meeting. And then we had another board member, Warren, submit some edits that he put together. So we have 2 documents that we'll look at today. So the agenda for today is we will take a look at the document that was originally provided by Tom Sensick, and I will give a little bit of information about what we received back from board work group members on that document. Then we will have a discussion of the document that was provided by Warren. That document came a little bit later, and so the work group members, I'm sorry, haven't had as much time to sit with that. So we might have a little bit longer discussion there. And then we're going to work together as a group to come up with a final recommendation for the board for the next board meeting. And then we'll adjourn at 8:30. So we've got a lot to do in a very short amount of time. So Katie, if you are ready, please call the roll.
Yes, Michelle Glass,
Present.
Warren George,
Present.
Debbie Diaz,
Present.
Amy Fellows.
Present.
Perfect. And then we also have Chunwei Chi as a member of this work group, but he is currently in Taiwan and unable to attend.
Thanks, Katie. Yeah, let's go to the next slide.
You're a little quiet, Jennifer. I don't know if
Oh.
there's a way for you to be a little louder.
Is it better if I speak directly into the microphone? Okay. Sometimes these headphones are a little off. Okay. So I am going to hand it over to Warren in just a moment because he is the group's facilitator. I did just want to give, as I said earlier, a little bit of information about the feedback that we got from the group on this document when everyone took a look at it. So there were a few changes made to the recommendations that the board had made. I'm sorry, the work group had made, in addition to Tom adding in the components of SB 1089, the values and principles from that. For feedback we got from the work group members was that the work group, for all members who commented, chose to stay with the original language that that was provided. The language choice options here, and we can talk a little bit about those, but to give you the background of what the work group members said, everyone was in consensus that we would use individuals and families instead of patient, that we would use individuals and families instead of resident or residents, and that we would choose to use equitable over consensus, as that was the language that the board had worked on, or the work group had worked on previously. The other comment was that there was no interest, or I shouldn't say no interest. The work group members had agreed that they would leave out the language that was added into this version that said that there would be no cost sharing, as there was agreement that this would be an element of plan design, and the plan design committee should have the opportunity to work through that instead of stating it in the values and principles for the work group. And so now I will hand it over to Warren to facilitate the rest of the conversation.
Thank you, Jenny. That was excellent, excellent summation. So first, let's look at the document that Tom Sensick sent in, which I think many aspects of were excellent. And yeah, many aspects of that were quite excellent. Hang on just a second here. Could you turn off that one? I realize my face is dark. The major changes that Tom put in were using what we had used as a separate issue of the equity statement, using it as a fifth principle. And another major change that he made was including the references to Senate Bill 1089, values and principles, along with each of our major principles. I really like parts of this, and I like the fact that it is a full, as Jenny describes it, a public-facing document, very well written, whereas what we had prepared for the board was more of our own notes. So I liked a lot of what Tom did, and we can just continue to scroll down this through this a little bit. And yes, I continue to like the way it's written, and he helps out, I think, a lot of what we were trying to do. For myself, and I'll open it up for a little bit of discussion. I thought that this, what I'll call Tom's version, leaves out some things that were important. Jenny, did you trying to get my attention here?
I just wanted to note for the members of the audience, for the public who are watching, if you are wondering what all of the notations are on this document, these are all references to where the language that is provided in this document, where you find it either in Senate Bill 1089 or in previous values and principles work, or new language that was added or not previously in another version is included and highlighted in green. I just wanted to make sure that everyone had those references. Thank you, Warren.
Thanks, Jenny. Yeah, continue on. If you'll continue to scroll down, many of the things that we were talking about are here, but if you will continue to scroll down, most of what we talked about for community ownership and governance was actually not in Tom's version. For that reason, I didn't feel like that I could support just a direct change out of the two versions. And so I attempted to write a hybrid looking at the taking advantage of the things that Tom had put in, but restoring the framework that our work group had put in. Working through this document, and it is something that I'm hoping that we can, I wrote this in order to, in hopes that we could reach consensus in a short meeting, but we really do need to see whether we have consensus. And of course, the choices are to go with Tom's document as written, or to use this hybrid, or to go back to what we had originally said, or it will be open to discussion. I'd like to discuss this kind of item by item. So the first thing that Tom had done was he had removed the equity statement and put it under a fifth principle. I have gone back to 4 principles, and including Tom's reference to SB 1089 as part of our document for equity statement. Is there any discussion on first on whether to stick with our original plan of an equity statement or going with a fifth principle? Seeing no discussion, I'll just point it.
There's two hands.
Okay.
Michelle, I think, had her hand up first.
Thank you for this work, Warren. I wanted to, I guess I'm a little curious. Like you, Warren, I see a lot of benefit in the way that the information was organized to be ready for public facing engagement. And, I'm hoping that the majority of our work would make sense to a member of the public who was following and engaging. And so I see a lot of benefit to some of the changes that were made. Although I agree with you, keeping our well-considered language is what is important as well. But I guess I'm curious what you felt was important about keeping the equity statement separate from an overarching principle. Like, what was that for you in terms of like why you pulled it out of one of the principles and put it back as a overarching statement?
This was a point that we on the work group had given considerable thought to, and we had, as a group, decided to elevate the equity statement as something above and beyond the four principles, because it is part of all four principles, and it's kind of above them. And it was because we had the discussion in the work group to decide to pull it out and put it above everything else, which is why I decided to kind of honor what we had already come to agreement on. I don't think including it as a fifth principle is disastrous. So if the rest of you felt strongly about doing that, I wouldn't object, but I still think it is so fundamental, and it's got to be part of everything that we do, not a separate principle. So that's why I made the decision to stick with the framework that we had gained consensus on. Any other discussion on this point?
Yeah, I'll jump in. I totally agree with you, Warren, that I think this is really important and very overarching to everything that we aim to do. But because of that, I see that as supporting keeping it as its own principle. So I actually definitely like it being pulled out into a fifth principle personally. I'm not sure how everyone else feels about that, but that's kind of where I'm at for the equity.
Okay. Let me be sure what I understood you say there, Debbie. You're saying that we should delete our equity statement and instead move it down as a fifth principle. Is that what I heard you to say?
In the way that Tom had it organized, I believe the statement was still in it, just it was pulled out separately. So I definitely think we need to keep the HEC statement. I think that's important, but I do like it being pulled out as its own principle as Tom had organized.
Is there any way to flip back to the Tom's real quickly.
While we're looking, I agree with you, Warren. I have to admit, I really struggled with how to organize all of this when we were working as a work group. And I, I agree. I think the equity principle is overarching, but I guess once I saw Tom's reorganization of the information, I realized that these are the overarching principles that guide all of the work of the board. And so it's a distinction without a difference, I guess, is what I came to in that moment once I saw it organized this way. If we have overarching principles that guide all of our work, and then we have a foundational principle that is over the overarching principles, then it becomes quite cumbersome for the public to follow what we're saying. So I think it simplifies things while keeping equity at the center, at the top, and making it clear that it guides all the work of the board. I just thought it was more digestible for us and for the public once I saw it organized this way. Although I admit I was part of that discussion and also argued for keeping it as a separate statement. Once I saw it, I thought it was more straightforward and therefore more useful for our purposes was my thought process.
As a point of our work today, if we then what we have on the table is either supporting Tom's structure, because the way that was written takes many of the principles out of our four that were organized under our four principles: the maximize health and places and the fair distribution and the others, and places it under the equity principle. So I think it would take, if we want to preserve the four principles, I think it would take some rewriting of the document in order to then remove those from the other four. I mean, we're down to 10 minutes to gain consensus here. So I would think that might require a rewrite. I mean, for me, I'm not willing to drop, for instance, the fact that Tom's statement loses what I think our important issues were on community or sense of community. And I'm not opposed to doing that, but I think that we would need some rewriting before I would be satisfied to just adopt Tom's statement, because I think at this point there are so many things that are in Tom's fifth principle, or in its case, the first principle, that I don't think we're prepared to issue a document.
I just want to say, any rewrites that need to be done, I can take that on for the board. If there are sections that you want to take from each of these two documents, or even from previous values and principles documents, I can accommodate that. And in terms of the difference between Tom's document and previous documents and the one that Warren put together for this, there are only two points from from SB 1089 that are included and moved up into the equity statement in Tom's document. And one of those, I was supposed to note at the beginning, isn't actually included. It wasn't done on purpose at all. There was just an oversight in the document that Warren submitted. One of the two, I believe it's 2.3AA, which is the first statement in Tom's document, isn't included in the document that Warren submitted. So I would be adding that back anyway. And so there wouldn't be a huge reorganization if that part of Tom's document were adopted and we moved that full sale into a new document, or adopted that as moving the equity statement into the overall principles, just as a consideration for you all.
And
Thank you,
Okay.
Jen. Michelle.
Sorry, just for clarity, for my part, speaking for myself, I just want to be clear that I'm not arguing for adopting Tom's document wholesale. My understanding of the question you were posing, Warren, was just about, do we stick with our original decision to keep the equity statement separate from an overarching principle, or do we like the way that Tom organized it as a fifth principle? And my answer was, I like the equity as a principle, but I think I would be in favor of looking at the thoughtful changes you've done, Warren, to the rest of that document, and then just including Tom's fifth principle at the top. So that's what I was saying. I wasn't saying throw out all of the edits that you've done and just adopt Tom's public comment as our values and principles. I was just saying I like the fifth principle at the top, and then I think that could go well with the edits you did to preserve some of our other changes in your document, Warren.
Okay, that's very helpful. That's very helpful, Michelle. And maybe if we, what I see is that we'd still have some reorganization to do of some things in the document, but that maybe we could accomplish that by accomplish that just by distributing a copy prior to our board meeting. If we can agree on a couple of other things. So Katie, if I could go back to the hybrid document that I had prepared, and we'll look at the other sections and make sure we have kind of agreement on the general, on a couple of general points. One is in presenting this, I realized there was some sense of confusion when we were using the words community ownership. Some people thought that actually meant like public ownership of all facilities, and that's not what we meant. So I was suggesting a sense of ownership, which I think is true to what Chen-Wei Chi was guiding us toward. So is there any disagreement on that change? And then continuing on, I'm actually using some of Tom's, one of the things I liked about Tom's document is it kind of provides a header for each section, which makes it very much more readable. And because in this, we had kind of two components. One was individual fulfillment. The other was on the order of community or public health concerns. And so I went back to our format of two separate issues and tried to maintain fairly true to Tom's document. And if we can see the rest of this section, Katie. As you have read through this, Michelle, Amy, and Debbie, do you see any problems with the way that this is presented? And I do like including the Senate Bill 1089 references. And I've maintained the other things that were asked for by board members, including the minimizing harm. I actually moved Tom's reference, I think, from a different section into this into this section on minimizing harm, of focusing on coverage of evidence-based healthcare. It could go in multiple places. Continuing with adding more descriptive terms beside individual fulfillment, maximizing health includes measuring and working toward general population health. And then what we had spoken of about that communities should have a say in what those measures are, and that and an important part to me, I think this might have been provided by Amy originally, that all health measures must support the Health Equity Commission statement, where I think that's actually should be Health Equity Committee. I'm not sure it's that could be a typo, but anyway, do we have kind of general support for that? Then under fair distribution of medical resources, I think this is a section where Tom really helps us out. We had just kind of tried to emphasize how complex a problem that is, but I think sticking with the principles and with our belief in community, involving communities to establish fairness, I think is intact and retains Tom's. So then minimizing financial hardship. But I think there maybe is addition of a few words, but I'm hoping that it retains both the committee or both our work group, what we had talked about in this area, as well as Tom's, some of Tom's wording. And we're retaining some of the things under E, we're retaining some things that that the work group had included in our own document. Then under 4, again, going with the sense of ownership. And then we had just talked about, single word bullets about economics, stewardship. And I added, tried to add wordings to be more consistent with Tom's writing style, which I like. And hopefully didn't lose anything. In fleshing out those statements, I did add some things that we had not talked about, or use verbiage that we had not talked about the work group. For instance, under the economic stewardship or financial stewardship, making efficient use of available healthcare dollars as a part of long-term community financial plan. And I'm hoping that that wording is more or less agreeable to you. And added something else that we had not talked about under the community interest, because I'm looking ahead to wanting these things to tie into the recommendations of the task force. And so what is the issue about wanting to separate employment from healthcare? And one of those issues is that tying the cost to employment discourages employment. And there's studies that back this up. But that is something that I had wanted to ask you about, because that is not something that we had talked about in the work group. So I guess the question then, if we do go with the principal will have a little bit of editing to do, but can you, you know, are the three of you generally in support, or what edits would you like to make to the other four? And I want to, of course, respect the public who were told the meeting would end at 8:30, and beg a little bit of patience as we try to get this done. And the work group considerations, those are unchanged. Those are unchanged from our previous document to the board. So I, yes, with begging the patience of the public, I ask you, Michelle, Amy, and Debbie, what do you see in this document that in the other 4 points as they're re-edited? Are you generally in favor or have concerns?
If I could, for the interest of time, if everyone is sort of at a good point of understanding where the changes have been made, what the changes are, and sort of the impetus behind the changes, possibly, if you guys would like, you could send me any notes or edits you have on the version that Warren submitted. I can write up a document that incorporates equity as the first principle there, and then go through this document and put it into the document that Warren submitted and provide that to everyone for another round of comments that maybe if you could submit, if everyone would have time to submit by Wednesday so that we can have that ready to go to be published with the other board documents by Thursday. Would that work better for everyone to have a little time to sit with it and understand the changes now that you've talked through them? I'm seeing consensus yes, or I should say head nod. Okay, in the interest of time, let's try and do that. I will move the equity statement back into Warren's document as one of the overarching principles, and then send that back out to everyone with all of the same notations there. I wanted to make one comment that I forgot to make earlier, and that was that Amy, earlier you had made a comment that you would like us to include in the equity statement rectifying past and current bias. I forgot to do that, and that was not in Tom's version, but Warren did add it back here. So I wanted to point that out. So
Okay,
I will
great.
reincorporate that and send it back out to the work group so that you can make any other final notes. And I'll put that version together if that works for everyone, and we can submit that for the board materials for next Thursday.
And the equity state will be the first one, like we had talked about.
Yeah.
Perfect.
Yes, moving that back to where it was in Tom's document, and then keeping the format for the rest, just adding it as one of the overarching principles. And the other thing that I wanted to note is I spoke to Morgan, and instead of including the recommendations within the document as they're outlined here, I can make slides for the board meeting that provide the recommendations themselves. So this stays more of a readable external facing document, as we saw with Tom's document, which didn't have the recommendation language, so that it looks more like a forward moving document, and we just do the recommendations up on the slides. Okay. Okay, Warren, you're good with that also?
Yes.
Okay, great, great. Okay, and to close it out, just as a reminder to everyone, please feel free to submit written comment or come to the meeting and provide virtual comment or come in person. As you can see, this work group takes the written comment from the public very, very seriously. So please feel free to provide any comment that you want. Katie can provide the information for that. And Katie, is there anything else we need to close out?
Nope, I believe you got it.
Okay, great. So Warren, do you want to say goodbye and thank everyone for us?
Yes, I don't know how many people got up early to watch us in the process, but appreciate the support and echo Jenny's statement that we encourage the written submissions, and this is certainly evidence that we do read them and consider them.
Thank you all so much. Have a wonderful Monday. Bye, everybody.
Thank you. Bye-bye.